Welcome to Seven Figure Chiro, the podcast that is all about taking your chiropractic practice to new financial heights. We're your hosts, Dr. Jeff and Kristen Berard.
And twice a month, we are here to share the insider strategies, tools, and success stories that will help you scale your chiropractic practice to seven figures and beyond.
Whether you're at the start of your journey as an associate or you're ready to take your practice to the next level, we've got expert interviews, strategies, and inspiring stories from chiropractors who have turned their dreams into a reality.
So get ready to take your chiropractic practice to a new level, and let's crush your vision for success.
Hello and welcome to Seven Figure Chiro Podcast. I'm your host, Dr. Jeff Berard. I'm here with Kristen Berard and Courtney Wilson. Courtney Wilson is a licensed acupuncturist. In today's episode 21, we're just going to talk about her experience integrating acupuncture into a multidisciplinary practice and all that entails. So welcome, Courtney. How are you?
Great. How are you?
Beautiful.
Thanks for having me.
Fantastic. So Courtney, just for the listeners, just obviously you're an acupuncturist, but just in your words, tell them what you do and your role in the office. Fire away.
Okay.
Courtney likes to laugh.
I thought Kristen was asking the questions.
She will.
Oh,
Jeff likes to own the show. I always have to butt in.
Okay.
I'm just starting it off. Get you relaxed, you know.
I'm always relaxed. What are you talking about? My role as an acupuncturist, I give acupuncture to patients. That's not what you mean, though.
Deep.
Courtney likes to poke people.
I like to poke people. Yeah.
All right, Kristen, fire away.
So, Courtney, let's just talk about what got you into acupuncture, and then let's talk about what brought you to our clinic as a multidisciplinary clinic so the listeners can get a better understanding of what acupuncture is, maybe why you went into acupuncture, and then what kind of brought you into our organization.
Okay, sure. So I like to say that I didn't find acupuncture. Acupuncture found me. At the age of 18, after I graduated high school, I got a co-op job at an acupuncture office. And I had no idea what it was. And I said, sure, I'll work there. And a couple days go by and I'm like, what do you do here? And the lady I worked for, she was like, acupuncture, don't you know what it is? And I said, no. So I worked there for 3 years while I went to community college, and I got to see how it helped people. And then I also got to experience acupuncture, as in like I would get treatments from her, and I fell in love with it. I didn't know what I wanted to do when I grew up, but when I landed this job, that's when I was like, oh my gosh, this is what I want to do. And I feel very fortunate to have the best job in the whole world.
Was that Shirley that you worked with before you became an acupuncturist?
Yes.
Okay. I don't know if I remember
at 18.
That.
Yeah.
Wow.
Yeah. So I had graduated, high school, and I didn't really know what I wanted to do with my life, but I knew I wanted to do something in healthcare. So I went to Delta, and then this job just like landed in my lap. And I truly believe that acupuncture found me because I didn't even know what it was.
Yeah. So most people say I still don't know what I want to do when I grow up, and they're in their 30s, 40s, or 50s. But I feel like you've kind of found that passion, and this is what you want to do forever. It looks like.
Oh, absolutely. And when I went to acupuncture school, I was only 21. Almost everyone was in their second or third career. So I was the youngest person that I graduated with, and everyone was like, how did you know you wanted to do this? And same story, right? Acupuncture found me.
So since you've become an acupuncturist, I'm sure you had some idea of what acupuncture was when you were working in the field as, an assistant or at the front desk. But once you became an acupuncturist, what are some of those misconceptions that the general public really talks about or assumes, or maybe even comes in and talks to you about with, various questions that they had no clue what acupuncture really was, or maybe they thought it was something different?
I would say that 9 times out of 10, when I'm doing an initial evaluation, I'll chat with them and then I'll say, "Do you have any questions?" And every single person, almost, says, "Well, does it hurt?" And it's not supposed to hurt. So no, it doesn't hurt, but everyone thinks that it hurts. The needles are very, very small. Um, they're like a human hair. A lot of times I will show them to a patient and they'll be like, "Oh, I thought it was going to be way bigger. I thought it was going to hurt." There's like, you can fit 20 to 40 small acupuncture needles in one hypodermic needle. So that's a pretty cool visual when I'm doing talks and stuff to explain it.
So just to get this differentiator out, can you explain the difference between dry needling and acupuncture? Because I know a lot of listeners maybe do dry needling, especially chiropractors that listen. And, this is part of this episode here is to try to share with other chiropractors and PTs of integrating other services in their office, such as acupuncture. And if they already do dry needling, maybe they don't know the differentiator between the two. Can you explain that just a little bit?
Yes. So it's taken me many years to figure out how to explain the difference that's just like kind of cut and dry. I would say that dry needling is something that is done within another service, meaning you do chiropractic and dry needling. You do physical therapy, and then an adjunct to physical therapy would be a small session of dry needling. So it's something that you add to something that you're already doing, whereas acupuncture is more of a standalone kind of whole body treatment. I can do more trigger point therapy on somebody, but that's typically within a realm of something else. So I wouldn't say dry needling goes to be standalone, but acupuncture can be standalone. So some people come to acupuncture and they still get dry needling. So did that make sense?
Yes, how about the technical application? Like, is there a difference in the needles? Is there a difference in the, the depth of puncture? Like, talk a little bit about the technical difference between dry needling and acupuncture.
That's a big question, only because all acupuncturists are different. So I tend to use a certain amount or a certain size of needle. I can use bigger, I can use smaller. Typically, a dry needle session is a larger needle diameter wise. Um, but just because that's typical doesn't mean that everybody does it. Also, depth of the needle could be, I could put something in very deep, but I also could put something in very surface level. So it's not really a cut and dry. Also, I don't know exactly how dry needling goes about on like a PT side, but what I assume and what I see happening is that the needle goes in and the practitioner pistons it, which is going in and out so that it gets a muscle spasm or a muscle release. And I typically don't do that as an acupuncturist, maybe a little bit. So I would say that acupuncture is more passive, whereas dry needling is much more active.
So my understanding, the limited knowledge that I have of the technical aspects of both is in acupuncture, you're dealing with more meridians. Am I right?
Yeah, meridians,
And
energy flow. Yep.
right. And dry needling, it's very focal. They try to identify areas of spasticity and they just target that, correct? I mean, that's the main differentiator is you're dealing with a holistic energy, chi channels, stuff that I don't know what I'm talking about. And you do. And then the practitioner that does dry needling, it's a focal point. So also something important to bring up, which isn't intended to offend people that do dry needling. I think the level of education is important to discuss because dry needling, I can literally go to a weekend course and start dry needling, and that's what they do.
Mm-hmm.
Whereas acupuncturist, I studied acupuncture in chiropractic school and I bailed out just because I was confused. It was a lot of information. I didn't understand it. And to be frank, I didn't want to understand it. I wanted to be good at what I wanted to be good at.
Mm-hmm.
So the depth of education. Just talk about the typical education that an acupuncturist has to go through. What's that look like?
Well, that's interesting that you said that about your experience at acupuncture, or at the beginning of acupuncture school. Acupuncture school is a 4-year master's program. And I would say the first 3 years I was gathering information, but I didn't understand it. It wasn't till the very last year of kind of putting it all together did the light bulbs go off, and it was like, oh, okay, this is why you had to learn everything separate. And until it all got put together at the very end, it was like, I wish I could go back to school now and just to do it all over, because I would have such a better understanding of how it works from the start. But I think we had like 4,000 or 2,500 classroom hours and at least 900 clinical hours before we could even take boards or needle patients. So
Cool. Well, I thought that was important to preface the discussion, just because a lot of listeners do dry needling, and well, I don't need that. I have dry needling, and there's clearly a difference in the whole premise of the service being offered. The two, we have both in our office, and they both are utilized very, very frequently. And there's a lot of overlap, like you said. There's a lot of people that do dry needling that also do acupuncture. A lot of chiropractic patients do dry needling and acupuncture. So just to kind of talk, demystify those things.
that was actually one of my, you asked me about misconceptions, and I only talked about one, but that was another one. Most people are like, so where did you get your certificate? Was it just a weekend course for me? And I'm like, no, like, I had to go to school for at total like 7 years. Then I had to take 4 different board exams. And so that is one of the other high misconceptions of what I do. And also relaxing. People think that it's not relaxing. It's like extremely relaxing.
Yeah, and dry needling essentially treats musculoskeletal pain. Acupuncture treats musculoskeletal pain, as well as a whole slew of medical conditions, anything from allergies to infertility to insomnia, smoking cessation. If there's a medical condition, there is a place for acupuncture in it.
Correct.
Yeah, and I would also say that it's all about the experience as well, right? So
Oh yeah.
differentiating between the dry needling and acupuncture, your sessions, a normal session after you do an initial is an hour long, and it really is all about the experience. I mean, you're in a room by yourself, relaxing.
Hmm.
You don't get that typically in a dry needling session. And that's really funny, because when we were talking about the difference between dry needling and acupuncture. So Courtney came in after we already had a physical therapist, but we didn't have dry needling at this time. And it was really funny when Eric, and Eric will be on a future episode, and we'll talk a little bit about the dry needling. And I'm sure we'll hear about it from the physical therapy perspective. But it was just really funny between Eric and Courtney, the dynamic between the two, because it is very difficult to try and explain something to a patient that doesn't understand the difference. And also, it doesn't sometimes make sense between the two different practitioners either. And so if the practitioner isn't able to disseminate that information, for the patient to understand, then how is the patient going to understand the difference between the two? And it was just kind of comical for about a year there when we first started offering dry needling. Courtney's like, well, I went to school for 7 years. and the physical therapist obviously goes to school for 7 years, but like Jeff said, it's typically a weekend or a couple weekends of a certification. So talk about a couple of the really positive experiences, maybe life-changing things that you've seen come from some of the patients that you've had over the course of the 7 years since you've been with us?
Yeah, I've been with you for 7 years now. So I would say that most of my quote unquote success stories are typically fertility, cause effect, right? Like we know it worked when there's a baby, but like one of the cases that sticks out is a lady that came in and she recurrent miscarriage. So she could get pregnant, but she couldn't keep the baby. And so she had like, I think when she finally came to me, she had had 7 miscarriages, and with the incorporation of acupuncture, and that's the only thing she did differently. She had her first baby and then she had another baby after that too, and I saw her both times. And so that's like, I mean, that's part of the reason why I think I have the best job in the whole world. One person being appreciative is awesome, and I get to say that I have a ton of people being appreciative. I had a lady that came in, not, this is not fertility, a headache migraine patient. She had said that she had had migraines since she was like 7 or something like that. And I'm pretty frank with people. Like, okay, I don't really think that acupuncture is going to cure your headaches. Like, you've had them. She's like, she's 60 now. You've had them for a long time. Probably acupuncture is not going to fix you. She came in for a few months weekly, just like I told her to. And when she told me that she hadn't had a headache or a migraine since starting, I didn't believe her. I was like, "No, it's okay. You can tell me the truth." Because sometimes people tell you what they want, what they think you want to hear, right?
Yeah.
And I was like, no, you can tell me. It's okay. And she's like, no, Courtney, seriously, I have not had a headache since starting acupuncture. And so she was
Wow.
one that like, so she did her course of treatment and then I didn't see her anymore. Pretty soon, maybe a year later, she comes back and she says, well, I guess I should have stuck with your recommendation of coming in monthly because they came back, but then we got them under control again. So those are two super, super cool stories.
What I find interesting is that, from my perspective, having acupuncture in the office as another service is everybody knows that stress is basically, the cause of all inflammation, and whether it's physical stress, mental stress, or chemical stress. But, you know, mental stress, people that have all these different types of mental disorders, whether they're anxiety, depression, PTSD, you name it, that stress creates this cortisol secretion. It creates the insulin to go up and they just feel like crap. And what I can state anecdotally is that patients that are receiving acupuncture in our office from you, those people that keep coming back, they don't keep coming back because of any particular ailment. It lowers their stress, which basically it helps the overall treatment that these patients are doing in the office with other providers. So if nothing else, just the stress alleviation has this systemic effect that does amazing things that you really can't quantify other than the patient's subjective feedback. And to me, that's good enough to have acupuncture in the office.
Absolutely. Acupuncture releases endorphins, and endorphins make you feel good. So that's one of the key reasons. That's why I fell in love with it.
So people that listen to this podcast, probably 99% of them will not have met Courtney in their lifetime, and it's really great in the office, especially when I'm looking at Google reviews, is to see the comments that people make. Not only are they super excited about the treatment that they got, but Courtney has this infectious like happiness about her. She's very smiley and happy and has a really positive personality, even if she's having a really shitty day. She'll walk in with a patient and you won't know. And people feed off of that and they love that. And I think that's another huge reason people come back to see you, because whether it's an amazing experience, just with the acupuncture service itself or not, it's, also the experience with the provider that keeps them wanting to come back. So you just got to keep doing what you're doing, because maybe we can duplicate you. Can we duplicate you? Can we try
Ooh,
that?
I don't think anyone's ready for that.
For selfish reasons, one of the great benefits of having acupuncture in the office is there's a lot of people that come to see Courtney that have no intention on engaging in any other service. And then, they build trust with us. And, inevitably, when a problem arises, they creep over into some of the other services, and that, I'm sure that spills over with Courtney as well. So this is the whole premise of, multidisciplinary and the complementary alternative medicine world, is the more different types of practitioners you have, you can create this coalesce these treatments to give patients convenience and better outcomes. So selfishly speaking, I like it because it brings a lot of people in the office that wouldn't have come in otherwise, and that's another reason to consider adding acupuncture to your current model, so that you can keep all the air bubbles out of the pipe, which I like to say.
So we're a multidisciplinary clinic, and we've talked about this in almost all of our episodes. With chiropractic, we started with massage and then added physical therapy. Then we added the acupuncture treatment and then added assisted stretch, and now also manage all the athletic training services in our community. What would you say drew you to a multidisciplinary clinic that offers multiple services, and what kind of benefits have you seen as an acupuncturist being able to work with multiple types of providers?
Well, first of all, I think it's awesome because a it's great to work with a lot of different people, and not just specialties. Most people who go into acupuncture are in that second, third career. It's because they want to work for themselves. That is not something that I ever wanted to do. I wanted to be with other people, not so much for even like friendship status, but also if I have a question, I'm knocking on Jeff's door, knocking on Eric's door, knocking on somebody's door saying, hey, I need help. Or do you think this would work with somebody? Or, hey, you saw this person, they're coming to see me. So it's so cool to be able to collaborate and to ask questions, because you can't get a hold of anybody if you're calling somebody, if they have, oh, this is what my chiropractor said. Well, I can't just call them up. It's very, it's unique. It's great. I love it. Not to mention the whole, it's a little family here now too.
Yeah, we totally love having the different services. And now that we have 2 locations, acupuncture has always been kind of on the top of our minds, and, thinking about adding acupuncture in another location. But the funny thing is we don't know how we're going to duplicate Courtney. And if they have such an amazing experience at our Midland location, and then they go to the Freeland location, they don't get the same experience. We do like our clinics to operate relatively the same. And sometimes it's really difficult to duplicate your providers.
Let me touch on something, Kristen. So one of the
Yeah.
things that Courtney brought up is she didn't want to be a sole proprietor. She didn't want to work on her own. But that just kind of segues into something that I think it's important to talk about, is even though Courtney doesn't work on her own, we have a structure with her where, it's kind of like a hybrid. So I like to say she this might not be appropriate, but she eats what she kills. And what I mean by that is, if I were to pay Courtney just a salary to come work for us, and she, I'm not saying this is Courtney, but sometimes people just aren't motivated to produce. And Courtney gets paid as she sees patients, and so she has that autonomy really to do as much or as little as she wants. She is obviously has to meet the standards of the office and our standard operating procedures, which sometimes can be burdensome, but she still is in control to a large degree of her income and her production. So the reason why I bring this up is some chiropractors, I can't afford to go hire an acupuncturist. Well, you can, because when we hired Courtney gets paid when she is doing a service. And if she's not doing a service, she's not getting paid. And she knows that. And that's one of the reasons why I'm sure she's driven and her schedule stays full, is for that reason. So those of you that maybe are interested in adding acupuncture but don't want to burden the expense, we have it set up so that there's no expense because it's offset by her production. So food for thought when considering adding an acupuncturist. It doesn't necessarily mean you have to take on expense. You just have to be creative on how you structure that so that it's a win-win for everybody.
Well, and I think, Courtney, you could probably speak to that, is you've seen the growth in your income potential over the last couple of years as well. Courtney started when she had really young children, and I mean, her children are still very young, but she now has a little bit more time to spend in the community and build relationships. And it's really shown by the growth of how busy she is and how many people are coming in, as opposed to how driven she is as well, and the experience that her patients are getting. So it's definitely a good add to a existing business, like a chiropractic business, adding acupuncture. They really do go hand in hand. From your perspective, what would you say is the reason why you've heard patients like to come to our clinic as a multidisciplinary clinic, as opposed to going to maybe a single standalone business? Or what kind of makes our clinic and what we offer stand out?
I had an older gentleman come the other day and he said, I mean, why would I go anywhere else? You have everything right here, all under one roof. Uh, so I think especially maybe elderly people too, you know how you're trying to make an appointment with an elderly person and they're like, oh, we have the eye doctor that day. That day is out. One day they think that one thing can only happen on one day. Well, here they don't have to do that, right? You can get your PT, you can get your chiropractic, and then you can have acupuncture too. And I would say that's like, a little cherry on top. So just being a very just easy, I guess, for people. Uh, and then also, if I am just seeing a patient just for acupuncture, they'll, once they get to know me and maybe start trusting me a little bit, they'll say, well, I've been seeing a chiropractor somewhere else. And can you tell me a little bit about your chiropractor? Because I'm not getting anywhere with mine. And so, but it takes a little bit of time and trust. And then I can say, obviously, our chiropractors are awesome and I see them, so you should too. But
So before I started the business, I did a lot of research on complementary alternative medicine, which is chiropractic, acupuncture, naturopath, all these non-medicinal services. And the survey they did, which was about 300,000 people, so it was a large survey, the majority of them, the number one thing they're looking for, those that are engaged in complementary alternative medicine, is convenience, because they're going to see the acupuncturist, and then they're going somewhere else for the massage therapist, and they're seeing this nutrition person somewhere else. So that's the whole reason why we brought it all together, is because we just listen to what the people want, and that's convenience. And it's often overlooked, is just the convenience for the patient to engage in the services that they're typically engaging in. When I started, and just it was myself, there was people that are going to see you, Courtney, when you were with Shirley. We were sending patients back and forth. There were patients that I was sending to a different physical therapist down the road. I mean, it was all over the place. And as soon as we conjoined all those professions under one roof, we really exploded. And that was the catalyst to create, a 7-figure chiro practice. So it's the convenience, I think, is something strongly to consider for your clients, even if that additional service of acupuncture, even if it's not bringing in a ton of revenue. Like, we don't make a ton of money having Courtney in the office directly, but we bring a lot of people in the office that then spill over. So you don't have to make money off that particular service. I know Courtney does, because she needs to be in, she needs to sustain herself financially, and we're happy she does. But that's not the reason why we have it in the office, is to make all this money. It's just a convenience for the patient, and that spills over to a better reputation of the business as a whole.
Let's think about the two different sides of this. If there's another acupuncturist out there that's listening and they're thinking, maybe owning my own place is not what I want to do, or maybe they own their own place and it's not as successful as they wanted, or maybe it's stressful. And then also on the other side, you have a clinic that offers chiropractic, maybe, or physical therapy, and they're maybe looking to expand or scale up. What kind of advice would you give the acupuncturists that are seeking, or the business owners that are seeking additional services?
I think keeping an open mind. I think possibly everyone thinks their service is the best, right? Because it's what you do, and everyone is right. Your service is great, but to have an open mind, to think that like it's not always fixable by one thing. I see people and then I'm saying, I think that you need a chiropractor or decompression. We've tried, and it's almost like even admitting that it might not just take one thing. And I am really open and honest with people about that. Hey, give this a shot. It pun very intended. Uh, give it a shot. And if it doesn't work, like it works for a lot of people, but it doesn't work for everybody. So just kind of more having an open mind of saying, like, maybe with the collaboration of everybody, the patient can even have more relief than they even thought they could have.
And a lot of providers, yeah, a lot of providers, and this is the problem, especially in the chiropractic industry, think that their service is the panacea to everything. Like, no matter what your problem is, we can solve it. And that's just not reality. And I think that's people aren't dumb. So when clients come to our office and they see that we integrate all this, I think that builds a lot of credibility, right? Being in an office with other professionals, there's this communication that's involved between provider and a lot of shared information in the office about what's best for the patient. And I think that instills a lot of trust in clients, whether, so when you consider joining a multidisciplinary, it does bring a lot of credibility to what we all do. I think that's my opinion. Not to say you can't be a sole practitioner, but it helps boost credibility when you have other people in your corner.
Well, and I also think that after listening to a lot of patients, because I ask a lot of questions to our providers from an administrative side of things and try and piece together all the little puzzle pieces with different providers in our office. And I think the biggest thing is that the patients feel like they can trust the providers in our organization because they know they're communicating with one another and they're working together on finding what the best solution for that patient is. And sometimes it's kind of like going to a hospital, but at the same time, you're in a hospital setting or in an organization where there's a huge span. I mean, multiple buildings, a lot of the departments don't work together. Well, in our clinic, we're all under one roof and we communicate daily, sometimes hourly with one another, can just pop into an office and talk to each other. And so we really emphasize provider communication, but also the patients see that and they hear that and it makes them feel more comfortable, I believe.
For those that are listening, many people that don't have acupuncture or don't know a lot about incorporating acupuncture for the most part is a cash-based service. With that being said, every state's a little different. Here in Michigan, there are some insurance policies that cover acupuncture. There's some federal policies like the VA, right? The veterans, they support acupuncture. Some of our teacher union policies cover acupuncture. So it doesn't only have to be a cash service. Some policies do cover it in our state, and I'm sure there's some states that do cover it as well. So just keep that in mind. It's nice that it's majority of a cash service, but there are some insurance policies that do pick up acupuncture.
And the HSAs, I feel like a lot of people don't realize that their HSA can cover it. And so if somebody is like one of my diehard patients and they're like, well, I want to come in twice a month, they know that and they budget for that before they even do their HSA for the year or whatever. So that's always exciting.
So we're getting towards the end of the episode and we're going to throw out some fun wrap-up questions. So let's talk about some interesting moments or memorable moments that have happened while working in our clinic, appropriate or inappropriate, because we're all one big happy family.
I wondered how appropriate I could be on this, but okay. It's the potluck thing. Does anyone remember what happened on the potluck staff meeting?
No, what happened?
We were doing a 2-hour, like yearly. This was years ago. Like all the signage stuff. What's that called?
Oh, were we reviewing all of our compliance stuff?
Yes, compliance. Thank you. And Sam and I had organized this potluck, and I was waiting to take needles out of somebody. And she goes, "Can you help me get the potluck started or like get everything out?" And I said, "Well, let me just wait. I got to take needles out and then I'll help you." And I thought about it and I was like, I can go help her. And so I went to help her, and we got our food and we started the meeting. And 10 minutes before the meeting was done, I got up like I had just, yeah. And I think Kristen said, "Where's Courtney going?" And
You
Sam said
forgot about the
she
patient.
either had to go to the bathroom right now or she forgot someone. And that was the only time I ever forgot someone. And I
Yes.
still see that patient every week. So
Yep.
she still comes in,
She's a
but
trooper.
she is. And she always,
She probably had a good nap.
she had a great nap. And she said the only thing that was the problem was that she was hungry because all the smells from the potluck were coming through the vents. And she said, "Well, I woke up and I'm awful hungry." So that was my most memorable moment so far.
I think that is hilarious. So, yes, Courtney is the queen of food. When anything, like when we talk about anything, does it involve food? And if it involves food, Courtney's there. She's raising her hand. She's going to be there. She's also the team cheerleader. And so I have threatened many, many years to buy her a team MSR, FSR, cheerleading outfit. And you were a cheerleader in high school, weren't you?
Oh yeah.
Yeah. So you just kept that going. You didn't quit that when you graduated high school. You just kept that going.
Yeah, I have to be positive just like my blood type,
And right there, ladies and gentlemen, that's Courtney's pickup lines.
Yes, absolutely. Or I can take a stab at it.
So I'm sure the listeners want to know, because all they've done for the past 20 episodes is listen to Jeff and I. So if you could say one thing or one word or anything to describe Jeff and then myself, what would you tell those listeners?
Be truthful.
There's not one word. I can't come up with one word there, but if I had to, it is hard. Jeff in himself is like this multidisciplinary person. So I think my word would have to be like inspirational, only because
I'll take that.
You're like just a little bit of everything. And I feel like everyone aspires to be like Jeff. Everybody, like, you're kind, you're compassionate. When you are in the room with
handsome.
Yes.
I didn't hear handsome.
Sorry. When you have a patient, like there's nothing else happening and you are just very caring. And so I just think you're like, and you're brilliant. So all these words.
We won't talk about the bad stuff today, though.
No, we don't have time for that.
No.
But no, I think like inspirational, because that would be what I would have to say.
Well, thank you.
I love it.
Now, Kristen.
Yeah, fire away.
Kristen, your word, would have to be, you're a lot of things too. A lot of great things. I would say resilient is a really good word for you. If there's a problem, you're going after it, and you're not afraid to speak your mind. And I think that that's a great attribute to have too, because you've got soft Jeff, who's very caring and compassionate and would give away all of his services. No, I'm just kidding.
He's got the halo, right? And yeah. I got the horns.
And then it's like, okay, but now we need to make sure that we are compliant and just you're resilient. Which is great. It's a good thing though.
Yeah.
Good job.
Thank
Courtney.
you. What is a day like with Courtney? And you can throw in the temper tantrums that you get after or before work too.
I like to say that before I get to work, I've already put in a full day's work. So I come to work to relax after the children. But anyway, it's, I come with my giant bag of food because I have to eat like food. I have to get here and I have to have breakfast, and then I have to see some patients, and then I have to do some laundry, and then I have to eat some more, and then I have to go around and make sure everyone's in a good mood and say hi and good morning to everyone. And then I just like to sprinkle a little bit of positivity in there for everyone, and just make sure everybody's having a good day. And we can't forget the question of the day. I have to go over to the gym and
Oh,
answer the
yeah.
question of the day. So
Well, thank you so much for getting on with us, Courtney, and answering all the fun questions and teaching all of our listeners about acupuncture. But more importantly, you are helping to educate other business owners on adding additional services into their already existing business and teaching them about ways to help them scale and become more profitable. So we appreciate your time, and maybe we'll find a good reason to bring you back on in the future.
all right, thanks for having me.
See, it wasn't that bad, was it, Courtney?
No, not at all.
No.
It was great.
Cool. Thank you for listening to the Seven Figure Chiro podcast. Your host, Dr. Jeff Berard. Thank you, Courtney Wilson, for joining us. Until next time, keep up the good fight.
Goodbye.
Thanks for tuning in to this episode of Seven Figure Chiro.
We hope you're walking away with some valuable insights to apply to your practice.
Remember, building a seven-figure practice doesn't happen overnight, but with the right strategies and mindset, it's absolutely within your reach.
If you enjoyed today's episode, don't forget to subscribe, leave a review, and share it with your fellow chiropractors who are on the same path.
And be sure to join us the next episode for more strategies, bring clarity to your vision, and elevate your financial practice to success.
Until then, keep pushing forward and making an impact.